This is a program that we've scheduled for a long time, and we thank the Lord for giving us the opportunity to give us two main people among us that are endowed with the resources to teach us about prostate health. And as we all men on this platform, prostate is something that we need to be aware of. And tonight our program is designed in a way that we can learn about everything that we need to know about it, preventative measures, things that we can do to prolong the health of our prostate and also to give us overall health. So at this time, I would like to ask if anybody's on the line that is not muted, please go ahead and mute yourself so we can start the program. On behalf of the AY 2000 year group, specifically AY US, North America, and Canada, and with our other brothers in the UK and all over the world, I would like to introduce y'all to our very own Dr. George Amoateng and Dr. Pius Owusu Afriyie. They are our main two resource for this prostate exam or prostate health talk. So I will yield the mic to Dr. Pius Afriyie to begin with his presentation on prostate health.
Thank you very much, Faraday. Thank you very much, all the audience, for gracing us here with your presence. This is a very important health topic. And, the last time we did something like this, it actually went far. I remember I went to church one time and I was approached by an older gentleman that, discussed the issues that we talked about on our last presentation. So just to let you know that, these things are very important and it goes really, really far, and we are very grateful for that. Anyway, self-introduction. My name is Pius Afriyie, former Pokuari student, my proud alma mater. I'll be joined by my fellow colleague, Dr. George Amoateng, who is going to be talking about the clinical and the functional preventative aspect of prostate health. I will pretty much dive into the anatomy and the physiology of prostate. All right, so let's begin. All right, so before we go in, I will talk about some definitions, functions, and location of this so-called prostate. I know it's a very important health topic in, when we meet our healthcare providers, or you may have heard it in different places somewhere about prostate, but this is an opportunity to really take a bigger look at it and see what it really is, what it does for the body, and how we can prevent disease states, that affects it. So definition of prostate. I hope everybody can hear me loud and clear. Okay. So the definition of a prostate, it's a very small walnut-sized gland that is located below the bladder. And you can find a prostate only in males. It is a bodily organ, but you can't find it in females. In the females, we have an anatomical equivalent that's like the Skene's gland. The Skene's gland is what produces female wetness. And in men, it is the prostate. I put a picture of a walnut on there just so that you can see what we're talking about, how small this organ really is. The function mainly is it produces fluid that helps the sperm to swim and it gets nourished by this prostatic fluid. And a little bit about the location, it's on the below the bladder, right below the bladder. And it's just anterior to the rectum, and it surrounds the urethra. The urethra is just a small tube that connects the bladder to the penis, whereby when you urinate, it passes through. Next slide, please. Can you go back to the previous slide, please? To the previous. No, to the previous. Oh, you're going far.
All the way back?
Yeah, all the way back.
All the way back.
Yeah.
Okay, so it starts here.
Yeah, now go to the next one. Yeah, the next one. This one. Right. So we will talk a little bit about the anatomy of the prostate. Let me situate my camera pretty good. All right. Let's talk about the anatomy of the prostate. So it is a small gland that is encased inside a hard capsule, like fibrous muscular capsule that has different glands, like glandular structures in it called the axini. And these axini is embedded inside a smooth muscle that is further held down in a rigid structure called the stroma. This axini is what actually produces the fluid that is inside of the prostate. Now, it is categorized into different zones. You have the peripheral zone, which happens to be the largest of the zones. It has the central zone that surrounds the ducts, the ejaculatory ducts. And then you have transitional zone. This is the site where most of benign prostatic hyperplasia do happen. When we say prostate enlargement, this is the site that it usually occurs. Previous slide. Right. So when you talk about anatomy of any organ in the body, you also have to talk about the blood supply. So every organ in the body has a conduit of blood supply that feeds it. You have arterial supply and a venous drainage. So the artery feeds the organ with rich oxygenated blood that has nutrients and oxygen. And when that organ utilizes that oxygen and the nutrients, it is drained out. The bad blood right now gets drained by the venous drainage into the lymphatic system. For the prostate, you have the prostatic arteries that branches from your iliac or the pudendal artery. And then you have the venous drainage that is also drained by the prostatic venous plexus and drains into the iliac veins. It drains into the veins and then it goes back into the heart, where it gets recycled back through the lungs and the whole 9 yards with the circulatory system. And then you get fresh blood back into the prostate for the prostate to keep being alive. Next slide. Now we talk about innervation. So you have the blood supply, you have the venous drainage, but you also have innervation, which is the nerve supply, the electrical current that keeps it alive. The electrical current is divided into two subcategories. You have the autonomic nervous system, which, is the autonomic nervous system that is differentiated in two categories, which is the sympathetic system and the parasympathetic system. The sympathetic system is the type of electrical current that you can control. It's pretty much unconscious, unconscious nerve impulse of the body. The fight or flight response. You don't actually consciously control the contractions of the prostate. And then you have the parasympathetic systems as well. Now, they have different parts of the body where they originate from. The sympathetic system originates from the thoracic level to the lumbar level, and then the parasympathetics originate from the sacral levels. The main role for the nerve impulse of the prostate is the ejaculatory function. It's able to contract to eject prostatic fluid out into the urethra through the penis. A little bit about the histology. Next slide, please. So there is a glandular structure, which is the axini. It's a small glandular sacs that produces the prostatic fluids. And these sacs are lined with the epithelial cells. That is, its main job is to come up with that fluid that stores in the glandular sacs that eventually gets released. Now, like I stated before, it's also held down by a connective tissue called the stroma and also the smooth muscles. All of this together form the histological structure of the prostate. Next slide. When we talk about prostate, as you know, for men's health, there is clinical significance, and that is prostate enlargement. We talk about inflammation or infection of the prostate, which is the prostatitis, and we also talk about malignancy, such as prostate cancer. Next slide, please. Those type of clinical significance, Dr. George will dive a little bit more deeper into it. So the prostate, as we know it, is an exocrine gland. Now, we have endocrine glands and we have exocrine glands. Endocrine glands are glands that do not have ducts. They just secrete hormones into the bloodstream. Now, we have something like the pancreas. See, the pancreas inside our body is an endocrine gland that produces hormones such as insulin, and it does not use ducts. It just goes straight into the bloodstream. There are other glands that are exocrine that have ducts that actually produce and release through the ductal system to the outer part of the body or to another organ, and prostate is one of them. Prostate produces the fluid and it ejects into a ductal system. The main role of that is a secretory function. It has also mechanical function and sphincter control. In the secretory function, its main job is to produce about 20 to 30% of the ejaculatory volume that we ejaculate, during sexual intercourse. Now, in this volume, you have enzymes or, rich nutrients that help the survival of the sperm. The prostate contains alkaline substance that kind of works as a buffer for the sperms in the vaginal environment. The female vagina is actually very acidic. The vaginal environment in the female is very acidic. So if a sperm gets in there, it's immediately antagonized. It faces a challenge to survive because the vaginal acidity is hostile to the sperm. And by design, the prostate fluid has this alkalinic substance that kind of creates a neutral zone for the sperm so that it can continue to survive to meet the egg. It also has other things such as zinc, citrate, and other proteins that liquefy, meaning that it makes the fluid more solvent or very liquid or very aqueous such that the sperm can actually swim and be more motile. And its mechanical function, as discussed earlier, it's able to contract, compress, to be able to eject the prostatic fluid out. And it helps in ejaculation. And there is also sphincter control. I stated earlier that the prostate is situated below the bladder. So, and it has a prostatic urethra. The urethra runs through the prostate, right? So if you have urine in the bladder, the urine runs through the prostate. So in order not to mix urine with seminal fluids or prostatic fluids, it has a sphincter that the prostate tries to control to prevent mixing of urine and semen. Next slide. Okay, so there is also hormonal regulation. The prostate grows as we grow. It's a type of organ that is very hormone dependent. It's androgen dependent. Androgen is male hormones, especially testosterone. So when it gets exposed to testosterone, it converts that testosterone into dihydrotestosterone that helps in its normal development and growth. And over time, if you gets too much exposure to this dihydrotestosterone, that's when you get the hyperplasia or the enlargement of the prostate. As you can see on the slide there, you have testosterone that goes through some oxidative reductive process, and it converts that into dihydrotestosterone. And this particular compound causes the prostate to grow bigger. Next slide. I know Dr. George is going to talk a bit more about the pathophysiology, but I will just go a little bit into that pathophysiology. So BPH, benign prostatic hyperplasia, which is pretty much the overgrowth of both the glandular epithelium and the stroma tissue in the transitional zone. Remember, I said the transitional zone of the prostate is where you really have the prostatic hyperplasia. So when it grows like that, when the bulkiness of the tissue grows, it constricts or compresses on the urethra. So you have this symptoms whereby you cannot, urinate properly. You have weaker stream. You wake up at night to urinate. When you finish urinating, you feel like there is a bit more that you still have to, void out, but you can't. Those type of symptoms. So it's a dynamic and static components. The dynamic meaning that you have increased adrenergic tone, you have a lot of innervation, which is the sympathetic nervous system acting a lot more on the prostate, causing the urethra to narrow. And then also you have the static components, which is pretty much the bulkiness of the tissue growing and compressing. So that circumferential compression of the urethra causes you to have that type of symptoms of prostate enlargement. Next slide. Okay. I also talked about prostatitis, which is inflammation, or it could also be infection of the prostate. So in acute phases, it's usually infection that does that type of cause that type of discomfort. It's pathogens or germs that end up going into your urethra through the penis somehow into the prostatic ducts and cause infection, and that causes swelling and pain. And then sometimes too, it's not just infection, it's more of inflammation, pelvic floor inflammation. You have muscles around the prostate that causes pain. Maybe you may have had some trauma that can also cause you to have that chronic prostatitic pain. And then we also have the cancer part of prostate, which is the malignant transformation of the cells. The type of cancer that usually happens there is adenocarcinoma, and it can be just localized to the prostate, and you may not have any symptoms with it, but then sometimes too it can be symptomatic or metastatic, and then goes beyond the prostate and into other structures of the body, especially the skeletal system, or the spine. So if you have back pain, that should also ring a bell to actually get your prostate checked. Exact cause of prostate cancer, we don't know, but we know that there are certain risk factors that can contribute. Genetic, age, certain exposures like pesticides, like Agent Orange, smoking, diet that is very high in calcium, and obesity, sedentary lifestyle. All of those things can, expose you or predispose you to malignancy. Next slide. So who's at risk for prostate problems? Increase in age. After 50, you are at an increased age. So just being an aging man alone, you are at risk for prostate problems, including prostate cancer. If you have a family history where a father, a brother, or a close male relative have had issues with the prostate, maybe you harbor that genetic trait or the oncogenes that's in you that can also predispose you to such health problem. Risk factors are divided into two. We have the ones that you cannot really control, the non-modifiable risk factors. Age, you cannot change your age. Benign prostatic hyperplasia and prostate cancer, it's usually rare in younger men, but it comes up later in life. And for race and ethnicity, we can't change that. We are born Black, so it's not something that we can change. And Black men in particular, we do have higher rates of prostate cancer. And we tend to get it much younger than in the white counterparts. And like I said earlier, inherited genes, if you have oncogenes of cancer, it can get turned on because of epigenetics, because of your environment that actually cause your oncogenes to be turned on, and that results in protein translations that turns out to be cancer. Modifiable risk factors, which is things that you can change, weight and lifestyle. You can try to do exercise to reduce your weight. Obesity is an inflammatory problem. Being fat can cause a lot of inflammation in your body. Inflammation is a problem because it causes the body to develop all sort of ailments. So obesity, sedentary lifestyle, smoking does cause inflammation. Diets that are high in saturated fats, processed foods, they all cause inflammation. And recurrence of infections can expose you to prostatitis. You get a lot of urinary tract infections or sexually transmitted infections, or if you have pelvic floor trauma. Hormonal and metabolic health. That's exposure to the dihydrotestosterone. If you convert a lot of testosterone into DHT, then you are also at risk for prostate-specific issues. Uncontrolled diabetes, hypertension may worsen the growth of prostate and also influence cancer behavior. So, a recap of my part of the presentation. So only men do have prostate, women do not have prostate, and the equivalent in a female is the Skene's gland. So in the embryonic stage, they form Skene's gland for female, and for males, ours turn to be prostate. Just like in the scrotum, the testicles are the female ovary. For men, that's our testicles. So during the embryonic development, there is a bifurcation of what becomes female and what's male. And like I said, it's a very small walnut-sized gland that do cause a lot of problems. It's very androgen hormone dependent. It means that its growth is dependent on influence of male hormones. So abnormal growth leads to enlargement, and just it being enlarged alone is not equivalent to cancer. So if you have prostate problems, your prostate is enlarged, does not actually mean that you have prostate cancer. Remember, I talked about transitional zones, the peripheral zones. There's different types of zones that get affected. So prostate enlargement does not actually equal prostate cancer. It's different parts and different things altogether. And like I said before, the symptoms leads to LUTS, which is lower urinary tract symptoms such as obstruction. When you try to pee, you cannot pee. When you pee is very, very weak, or you strain before you are able to void. You wake up at night a lot, and after you've voided, after you've urinated, you feel like there's still more, but you can't really get it out. Mm-hmm. Okay, so that concludes my part of the presentation. I'll hand it over to Dr. George that will go over into the clinical aspects and also the preventative care of prostate. Thank you.
Thank you so much, Dr. Pius and Dr. George. Ball's in your court.
Okay, Dr. Pius, thank you for giving us an insightful approach on this issue. So, as you can see, my name is Dr. George Amoateng, and I'm glad that we are going to touch on this issue because in many of our African and Ghanaian families, men's health is rarely discussed. So I'm glad that we are now taking proactive steps like this to talk about our health, prostate health and sexual health. We barely talk about because of we feel like it's embarrassing or sort of weakness to talk about it. So it's a good step. So I'll go ahead and start presentation. So I would like to start with a condition called benign prostatic hyperplasia. I'm starting with this because the symptoms mimics prostate cancer, like all the symptoms of BPH mimics prostate cancer. That if you're experiencing, you might think, I may have a cancer, so we always have to rule out benign prostatic hyperplasia. So benign prostatic hyperplasia means not harmful, it's not dangerous. And hyperplasia means enlargement. So this is just simply your prostate being enlarged. And it's common in men over 50 years. As we age, our prostate enlarges. And the important thing is we have to know that it's not cancer. It's just an enlargement. And the left side of the picture is normal prostate. You see where you urinate. The bladder is sitting on the top, and when you urinate, it goes down, which is the urethra. So when your bladder enlarges, it just squeezes the urethra. So you're going to have painful urination and other symptoms, other urinary symptoms. So next slide. So why do we have BPH? Why does it happen? So like Dr. Pius said, aging alone is a huge risk factor. They did some studies and almost 50% of people from 50, 60, 70, most of them had enlarged prostate. So as you age, your hormones, there's hormone destruction, and like hormones like DHT, you need certain quantity to maintain your prostate. When you age, it increases and it becomes so sensitive to the prostate. So your prostate now enlarges because of DHT increasing. And also genetics play a role. If due to genetics, it also affects the genetic, affects hormones. And if you have a family history, your brother, your aunt, your brother, your father in your family, if they had it, then you are most likely to have it too. And also obesity and lifestyle also affects prostate health. So if you're obese, if you eat junk food a lot, if you don't exercise, hypertension, all those things increase your risk of BPH. Okay, next slide, please. Ready?
Yeah.
We can go to the next slide.
Next slide. One after.
Yes. Okay, so symptoms. So symptoms of BPH is very similar to prostate cancer. So first symptom, we have frequent urination. Almost like every second, every minute you wanna go urinate. Urinary hesitancy is when you always feel like urinating, even if there's no urine in your bladder, but you just feel like can we go back? Oh.
Yep. One more.
Yeah. Can we go back to the symptoms?
Okay. Okay, I'm at the symptoms right now. Weak stream, emergency.
The previous one. This one is a screening.
Right here.
Yeah, go back.
This is back. This is symptoms. Common symptoms.
Oh yeah, right here. No. Yeah. So urinary hesitance, like you want to pee and you try your best, like you strain to pee, but it's not coming. Like you really want to pee, but it doesn't want to come, right? Nocturia is you wake up at night, then you want to pee like about 3 or 4 times in the night. Decrease of force of urination, you have to like strain yourself to pee. And urgent urination, like you can't hold your urine, you wanna run to urinate. Incomplete emptying, after you urinate, you still feel like you have more urine left in your bladder. Okay, next slide, please. Okay, so screening tests here. We have several screening tests. We have prostate-specific antigen blood test, where we test for specific antigens. So the higher the number, the likelihood that you are having BPH or prostate cancer. So it's not cancer specific, but if you have it, then it's most likely you have BPH or cancer. Then digital rectal exams, where we go through your anus with the finger, then we measure, we test for the roundness, smoothness, irregularity of a prostate. So as you can see in the image, you go there, then you just feel it and see how the size is or how round it is. So if it's irregular, then it's likely that you have a cancer. But if it's enlarged but then it's round, it's most likely just an enlargement. Also, we can do ultrasound, but the most specific test to make sure you have cancer or not is the biopsy. That will confirm your suspicion. Okay, next slide. Okay, so with the diagnosis, like I said, eventually biopsy is what's going to confirm, but then if we do ultrasound or MRI, like on the right side of this image, the prostate will be enlarged and it will be irregular, and that will confirm the cancer. So we start with the PSA test, ultrasound, and history, digital rectal exams, but then we use biopsy to confirm. Okay, next one. So stages of prostate cancer. So it's very important that we do the screening. We have to normalize screening because determine it early will show whether you're going to survive or not. So we start with stage 1. That's if you find it early. It's very small and it will be localized. Very small, localized. If we find it at that stage, it's very treatable. Then the next stage will be stage 2, which will be larger but still localized in the prostate. And that one too is treatable. And we go to stage 3, where it starts spreading to nearby tissues. So from stage 3 to stage 4, that's where the survival rate declines. So when it goes to stage 4, now it has moved to distant organs and the survival rates diminish, unfortunately. So early screening is our best shot to prostate cancer survival. Okay, next one. Okay, so prevention strategies. Prevention, when it comes to cancer, right? Prevention, or even any health condition, prevention is the best way to deal with all kinds of diseases and conditions. So if your food is anything on the screen like this, colorful, whole foods, natural, it can prevent almost any kind of diseases. So all kinds of diseases start with our nutrition. Yeah, besides factors that we cannot control, but everything else starts with food. So healthy diets, especially when it comes to prostate, we have tomato. For some reason, for prostate cancer, your tomato, you need to cook it. When you cook it, we have a compound called lycopene, which increases in tomato when it's cooked versus the raw one. Leafy green vegetables, they also have antioxidants that will help prevent almost all cancer. Regular exercise. The studies have shown that exercise, anybody who exercises regularly increases your lifespan for about 10 years if you do regular exercise. And routine screening, we cannot overstress on this. Like, it's very important. You need to do routine screening. The earlier you find it, the better your chance of survival. And avoid smoking and alcohol. This is also true for all sorts of diseases and conditions and cancers. Okay, next slide. So I gathered some evidence-based supplements that are very crucial in preventing cancers in general. Okay, so which includes prostate cancer for this purpose. Next slide. So for all cancers, right? The general idea of cancer is we have there will be DNA damage, which will lead to mutation, then leads to uncontrolled cell multiplication. So these whole supplements, they focuses on some parts and mechanisms of cancer formation. So vitamin D is very important, especially in our Black community, because of our skin because of the melanin and stuff in our skin, we are not able to absorb vitamin D from sunlight. So we always need vitamin D. It's very important, not only for prostate cancer, but for all sorts of conditions. So it is very imperative that everybody, if you do your blood test, you let them measure your vitamin D, and about 80% of the population, we have low level of vitamin D. So you have to measure your vitamin D levels and take supplements. Yeah. So vitamin D will reduce inflammation and also promotes apoptosis, which is death of abnormal cells. So abnormal cells are the cancer cells. So vitamin D will help prevent that. Okay, next slide. Okay, zinc is also very important in cancer prevention, right? So like vitamin D, it will inhibit abnormal cell growth and reduces inflammation. Next slide. Omega-3 fatty acids, also very important for your prostate, for your heart, and for general health. So it has anti-inflammatory effects. It reduces oxidative stress and supports hormone regulations, and also slow abnormal prostate cells. Next slide. So we have lycopene, which is also very important. All cancer cells need blood supply, and lycopene plays role in cutting the blood supply for cancer cells. So lycopene you can find lycopene in tomatoes, cooked tomatoes, and watermelon, pomegranate, and other juices. So it reduces tumor growth, it protects DNA from damage, and it's enhanced when we cook it with oil. Like if you are eating your salad and you have tomato in, you can pour a little bit of olive oil on it, and it will enhance absorption of lycopene. Okay, next slide. Okay, next one, this one is selenium, and it's also an antioxidant and protects cells from mutation. And we know mutation leads to cancer. So if you take selenium, combine it with vitamin D, zinc, they all help prevent mutation, and it will support DNA repair mechanisms. So next slide. Okay, green tea is also very important, but I'll stress on green tea, the raw herbal green tea with no sugar, no milk. It inhibits cancer cell growth and also reduces DHT hormone. As we already said, DHT increases prostate hyperplasia or prostate enlargement. Green tea also has strong antioxidant and anti-inflammatory properties, and is shown to reduce PSA levels in high-risk men. Next slide. Turmeric is very important, and because of its anti-inflammatory properties, it also blocks cancer-promoting pathways and enhances cancer cell death. it's important that you add black peppers to turmeric because of the absorption rate. The absorption rate doubles when you add black pepper. Yeah, next slide. This supplement, saw palmetto, it reduces the hormone DHT and also support prostate function in general. So all these things are for prevention, and prevention, like they say, is better than cure. So if we do all these, we take all these measures, we will prevent prostate cancer and other cancers. Next slide. This is also, pomegranate is also known to help the prostate a lot. So it also slows cancer cell death. It slows cancers growth, and also have antioxidants properties, and is shown to slow the PSA doubling time. Next one. So I've also researched on some drinks, some natural juices that will help prevent prostate cancer. So next one. Green tea, like we talked, green tea was on the previous slide, and it's a powerful antioxidant which reduces inflammations and lower DHT levels. All these help prevent all cancers. So instead of orange juices and other juices that contain sugar, you rather drink your green tea raw, in a raw form. Next slide. Cranberry juice also have anti-inflammatory properties. Then it's always helpful to choose the unsweetened versions. So naturally, some of these juices contain sugar, but then you can use some hacks. But even though it helps, it has beneficial properties because of the sugar levels. It can also have impact on your blood sugar. So if you take some of these juices like cranberry juice, watermelon juice, what you can do is move around, right? If you take these, or if you eat any carbs, you move around, walk for maybe 10 minutes, walk on your treadmill, just walk around for about 10 minutes, and it will help reduce the sugar level. Or take things like berberine before you eat or drink these kind of juices. Yeah, next slide. Turmeric and ginger tea. We have some teas on the market. It's combined already, so if you drink these, they all have cancer promoting, they block cancer promoting pathways and improve your immune function in general. So it's very important. Okay, next slide. Pomegranate is the fruit or the juice. So this is the juice. It has polyphenols, which is very important in preventing cancer. It slows cancer cell growth, and is shown to slow the PSA doubling time. Next slide. Water is very important because if we drink water, good amount of water, it flushes the toxins in us and supports our urinary health and reduces irritation of the prostate. Okay, next one. So in summary, I would say with cancer, you like to prevent it. You don't want to get it before you go for the treatment. And like, I didn't even stress on treatment because most of these things is surgery and therapies that you don't want to go through. So it's better we focus on the prevention to save our lives. So healthy lifestyle, exercising, avoiding junk food, eating whole grain, whole natural food, whole vegetables, and the juices that and drinks that I spoke about on the previous slides. Those will help decrease our chance of getting any kind of cancer. So it is very important that we focus on these things that we've spoken about to increase our general health. So at this point, you will go over to our brother Faraday and get some questions. We'll answer your questions for you.
All right, thank you so much, Dr. Amoateng, and Dr. Pius Afriyie. We thank you for such an in-depth and knowledgeable and really thorough explanation about prostate health. And I believe that it is something that we all take it very serious. This is the time, this is the point of the program that we want to really educate ourselves as men, and also not just as men, but also as African men, because we know that as Black men, there are certain aspects of the disease that basically attacks us more than our Caucasian counterparts. So we do have some structured questions, and if anybody have any question or any remarks, we want you to put it in the comment section. But we also have some questions that we've actually gleaned from this discussion. So the first question that I'm gonna ask, I'll go first with Dr. Pius, because he's the first one that did this presentation. So Dr. Pius, the first question that I have for you is that could you highlight any preventative measures that are particularly relevant for men of African descent here in the diaspora? Any preventive measures that we can take to avoid getting this disease?
Yeah, that's a very good question. Thank you so much for that opportunity. Preventive measures for men of African American descent, in particular, should actually focus on regular screenings, as Dr. George said. Screening for prostate, getting a DRE exam, digital rectal exam. And what's key here is that we tend to get the disease at a much younger age. And so it's actually recommended that we get screening at around starting age 40. Educating about risk factors, including family history, lifestyle choices. All these things are very crucial. Also promoting awareness about the importance of early detection, because if you're able to detect it early, your survivability actually increases. You are able to cure the disease much more efficiently than you wait until it's detected in the later stages. So those are some of the preventive measures that we can actually do to actually secure ourselves and promote prostate health.
Thank you so much. Thank you, Dr. Pius. The follow-up question that we have is that we know that trust in healthcare can be a big issue, and especially for immigrants. How do you suggest we bridge that gap and encourage more conversations about men's health in our community? How do you suggest that we do that to bridge that gap of healthcare and encourage conversations within our community?
Right. Cultural competency is actually part of some medical school curriculum. You have to build trust in the healthcare system that actually is culturally, competent and open to dialogues. You have to host community forums, just like we're doing right now, to talk, about issues like this that really affect us. So engaging in, trusted community leaders, healthcare providers, having these candid conversations about prostate health will actually give better outcomes.
Thank you so much. And my last but one question for Dr. Pius is that are there any lifestyle changes that you think are important or very impactful for men in their 40s and 50s that we should be considering? Specific lifestyle changes that you think we should consider if we're not already doing it?
Yes, so we will continue to talk about lifestyle modifications in all aspects of health, and prostate is no different. Prostate health is no different from, cardiac health or brain health or intestinal or whatever health. It involves lifestyle changes that maintain balanced diet, eating diets that are rich in fruits, doing regular physical activity and avoiding sedentary lifestyle, avoiding tobacco products, doing stress management techniques such as mindfulness or yoga. That all of these things can be overall very, very beneficial for our health, including prostate health.
Thank you so much. So, Dr. Pius, in your candid experience, do you know of any strategy that we can incorporate into our daily lives that we can bring our relatives, our wives, our children, extended relatives into supporting men's health and in a more proactive way? Is there any strategies that we can employ in our quest to achieve this prostate health?
Certainly. Involving family members can be done through education and shared health goals. Encouraging family members to participate in health screenings together, or to support healthy cooking, doing exercise habits together, going on jogging, going to the gym together, creating a supportive environment where discussing health issues such as what we're doing now is normalized, and it can empower men to take charge of their health in general.
Thank you so much, Dr. Pius, and I thank you for your rich input into this subject. Dr. G, the next set of questions is for you, sir. The first question was that given our shared Ghanaian heritage, could you talk a bit about how cultural attitudes back home towards men's health might impact how we approach our prostate healthcare in the US or even around the globe?
Yeah. So many of us, we grew in a culture where men's health is really discussed. So in our culture, we feel like talking about men's health or reproduction health is a source of embarrassing or source of weakness. So we always think that you have to be in pain in order to talk about your health issues. So if we can change that attitude and talk about it openly, is going to help us a lot. Because with the mindset that we are embarrassed to talk about our sexual issues or sexual health, that mindset will follow us as we travel abroad. It still follows us, and these lead to delayed screening and delayed diagnosis. And usually, if we do that, we find out our conditions at a later stage where there will be no help or very expensive to treat. So if we can change that mindset and reframe prostate care or sexual health as a sense of responsibility and strength and not weakness, that will help us approach our health in the right way.
Thank you so much, Dr. G. And I like the fact that you mentioned the sense of responsibility, and healthcare should never be viewed as a weakness. And it looks like it's almost a taboo in our culture to talk about your sexual health in that regard as men. My follow-up question, Dr. G, for you is that in our community, we often rely on traditional remedies alongside modern medicine. Could you share any insights on how we can balance the two when it comes to prostate health? And I ask this because of the fact that traditionally, even if COVID gave us some insights into when COVID happened, there was this mad dash to drink Sobolo and all these other concoctions that led a lot of folks into getting diagnoses for diabetes because of the sugar overload and other things. So can you speak on how we can balance our prostate health with our traditional medicines?
Well, like back home, like we are blessed with natural stuff, and we depend on herbal medicine a lot, and it's a strength, not weakness. Like we have our local herbs or spices like precursor, the other cloves and other stuff, right? They are very important in preventing these kind of issues. The only thing is we have to embrace, we shouldn't depend on that one alone. We have to embrace the modern health, combine them, and give us a synergic effect, right? So if we do more research on our local herbs and how it's going to help us, then also talk with our doctors. Any herbal medicine that we take, we need to discuss with our doctor, because sometimes it may have an effect, may have a bad effects with our modern medicine. So we should always talk with our doctors to make sure we can combine them. So if we do embrace modern health with our traditional health, it's always going to help us.
Thank you so much, Dr. G. Dr. G, so what role do you think family history plays, especially in families with our backgrounds? And how can we encourage our relatives, both here and back in Ghana, to get screened for prostate cancer?
Question again?
The question was that what role do you think our family history plays, especially with families with our backgrounds, and how can we encourage? Are there any strategies that we can employ to encourage our relatives, both here in abroad and also back home in Ghana, to get screened for their prostate health?
Yeah, when it comes to prostate health, screening is the number one important thing that we should do. So our family history always plays a role. So if you have any relative, your uncle, your brother, anybody in your family with a history, your risk also increases significantly. So we should always see it as a sense of strength to always discuss. Like you can call your brother, your aunt, your brother, your father, anybody in your family, and just normalize the issue of screening. Say, hey, bro, have you screened for prostate cancer? You are over 40 now. Have you done this? Bro, how was your sugar last year? Did you check? Like all those sorts of things. Discussion will help make the right decisions when it comes to our prostate health and or health in general. So we should have an open discussion and dialogue, and that will help us a lot.
Thank you so much, Dr. G. And my last question for Dr. G, and then after this, the floor will be open. If anybody have any questions, you can either type your question into the chat, or you can raise your hand, and then I will call on you for you to ask your question to the esteemed panel. Dr. G, are there any particular food or any dietary supplements from our local Ghanaian cuisine that can support our prostate health? Is there any specific foods that can support us?
Yes, like back home we are blessed with natural food. So some food like tomato, like shito, for instance, will be good for your prostate health, because if you make your shito with real tomato, like not the canned tomatoes that we have in America and other countries, if we make our shito with real tomatoes, with onions, right? If we eat fruits like pomegranate, watermelon, all natural, because most of the food here are GMO, right? Genetically modified. But then back home, we don't have those issues. They are trying to introduce it these days to, back home. But then if you are aware of these things, you always find food from the local farms, local market, or even better, grow your own food. And back home, we have the opportunity. It's easy to do such things than here. So like watermelon, tomato, onions, pomegranate, green tea, moringa, and all those local herbs, they help with the prostate cancer and prostate enlargements.
Thank you so much, Dr. G. And well, brothers, the floor is open. This is the time that we can ask our own questions. Any question that I didn't capture, please go ahead. You can raise your hand. We have a few minutes left for the questions and answer the Q&A. So if you have a question, please go ahead. This is the time. Or if you have any comments about prostate health, this is the time as well. It looks like there's a question here. It looks like my brother Obe said, in prevention, can you please highlight how you can prevent sugar spikes for the kind of fruits that have high glycemic index? You mentioned pomegranate and some other fruits that helps prevent or maintain our prostate health. And our brother is saying that how can we prevent the sugar spikes that comes along with those fruits?
Okay, so there are some few hacks that I can enlighten. So if you drink any of these juices, like pomegranate is has very high sugar content, watermelon very high sugar content, even though it got compounds that is going to help us. So research has proven that movement is very important. Right after drinking or eating such foods, you have to move for about 10 minutes. You can move, like walk in the community, walk in your neighborhood, walk on the treadmill, do a little bit jumping on the trampoline, or just go your stairs back and forth for about 10 minutes. If you do that, your sugar, like if you wanna prove it, just do your blood test. Then after 10 minutes of a little bit exercise, do it again. You see that your sugar has greatly reduced. Or we also have supplements like berberine. If you go to Amazon, you type berberine, It's also known to reduce sugar impacts. So if you take it before you eat, then after that you exercise, it will mitigate the effects of sugar on you. So those are some of the things that you can do.
Thank you so much, Dr. G. Dr. Pius, you have anything to add to that question?
Yeah, so naturally, fructose sugar, which is oligosaccharide, it's usually naturally healthy for the body. When you combine protein with it, it helps in its absorption. So eating it alone, it could be okay, but then if you eat it with protein, that usually helps. And just like Dr. George said, always try to burn up some calories after consumption, and moderation is always key. You always have to do things in moderation. If you eat it in moderation, then the way your body is designed, it's going to absorb it the way that it's designed to absorb. If you don't overload a lot of sugar, then your body doesn't need to stress itself with the overload. If you eat in moderation, your body will have a natural way of absorption of the sugar and utilizing that sugar.
Thank you so much. It sounds like protein is almost the key here, and exercise, movement and protein is the key. I have a question here posted by brother AY203. He said, if you know that your grandfather had prostate issues, your dad had the same issues, how likely is it for you to avoid or escape this genetic transfer that we mentioned in your own life?
Okay,
so it goes to either party.
Okay. If you know your family history, right, then the best thing you can do for yourself is screening. Like we are saying, prostate cancer or prostate enlargement increases after age 50. But if you know you have a family history, then you probably have to start yours around age 30 and then do it consistently every year, right? So just in case you're going to have it and there is no nothing that you can do because it's genetics, right? Then if you detect it early, if we're going to have a cancer and you detect it early, we're going to detect it as stage 1, as we discussed earlier. Once you see it on stage 1, then it's like 100% treatable. So the issue is screening. Just do early screening. If you cannot help that risk factor, do screening, detect it early, and then get treated. But if you wait, like as in the general population, then you may find it at the stage 2, 3, 4, where nobody can help you. Or because prostate cancer is very dangerous, and it's very uncomfortable. Imagine we put a catheter in your penis for you to urinate. First of all, it's kind of embarrassing where somebody needs to hold your penis to help you pee, and so you don't want to be in this situation. Very painful, very kind of embarrassing. So it's better you screen, even if your family member doesn't have it. Just do early screening and consistent screening.
Okay. And the little I can add is that if you have family history of prostate, especially father, brother, male relatives that do have prostate issues, and you are worried because you might also have it. It's true that you're worried, but it's not 100% guaranteed that you will get prostate issues. Now, the risk of developing prostate issues, whether it's enlargement or cancer, is raised about, I would say, 2 to 3 times. But it does not always mean you are 100% going to get the disease, right? So you have to be doing the early screenings to make sure that you detect it early. Now, you may probably inherit the oncogenes or the genes that will eventually turn on to become, to cause prostate issues. Now, there is something called epigenetics. Your lifestyle, your environment has influence on your genes. So you may have the oncogenes all right to probably turn it on. But if your epigenetics are good, your lifestyle is good, you exercise, you do your screenings, you do your fruits and vegetables, you manage your stress, you may actually not turn on those genes. But the fact that your male relatives do have that, it increases your risk, right? Your risk is higher than the other person that does not have that risk. So epigenetics have something to do with you expressing those genes. So don't create more stress for yourself just because father and brother do have it. If father, brother, and male relatives do have it, what you need to do is do earlier screenings and manage your lifestyle such that, if there is any prostate issues, you catch it early and you're able to deal with it early, or you mitigate it by, influencing your oncogenes with epigenetics and make sure that it does not express. And it's very possible.
Thank you so much, Doc. AY 203 had a follow-up question. And this will be the last question for the sake of time. He says he want to know, he says he's been doing the PSA 2 times every year. Is there another test that needs to be done apart from the PSA?
Yes. Okay, so the PSA is not cancer specific, but then if you do PSA, it's telling you that, and if it's positive, right, it's telling you that you may have prostate enlargement or prostate cancer. So if only the PSA values are normal, then we do other tests, like we can do the digital rectal exams, and then if we do it and the prostate is enlarged, it has nodule or is irregular, right, then most likely you may have a prostate cancer. But then if you have those irregularities, that is when we do biopsy. We take biopsy of the prostate, and that's the only way to confirm it. So those are the other tests. We can do ultrasound, MRI, and eventually confirmation is the biopsy.
Yeah. So PSA, it's pretty much a screening tool, which is non-specific. So if you test it and it's normal, then it's normal. If it's abnormal, then we look further. Like he was saying, you do the digital rectal exam to check for irregularities, and then you do the ultrasound or biopsy to confirm. The only way to really confirm cancer, yes, you may have high suspicion, but the only way to confirm, malignancy is to do a biopsy, which actually checks for the histology, the actual structures, the cells, the tumors, to see if it's truly malignant. Sometimes too, if it's caught late, CBC can tell, which is your complete blood count. We have something in the complete blood count called WBC, white blood cells. The white blood cells in a cancer person, it can be extremely low or it could be excessively high. That's if it's like really, really late in the game. But screening is always important. If your PSA is normal, it's a good thing. But like he's saying, biopsy is the way to go to confirm that you have prostate cancer.
Thank you so much, Dr. G, Dr. Pius. It looks like we have the last question coming from Brother Henry Ekwe. Please unmute yourself and go ahead and ask your question.
All right, thank you very much, moderator. Thank you very much, Dr. G and Dr. Pius. So my question is, during Dr. G's presentation, he did mention about sexual activity, which is not kind of normally overlooked. My question is that how does sexual activity link to prostate health?
Okay, this is a good question, and so basically frequent ejaculation, right? This is not to promote fornication or adultery, but frequent sexual activity, I would say, with your wife or partner decreases the risk of prostate cancer or enlargement. That is what studies have shown. So if there's frequent ejaculations, it does help. And when your semens are stuck and there's no way to come out naturally, if you don't perform sexual activities, I mean, there is natural ways of you ejaculating. Sometimes you may even dream and your semens will come out. So there's a natural way of letting it out. But then, healthy sexual activity will also help with the prostate health.
Yeah. It is very true, because we have something called epididymal hypertension, which is you have a lot of engorgement of blood flow to your genital area, and we call it blue balls, because you have engorgement of the genital area, and it can cause pain. So it's only relieved by ejaculating. So certainly frequent ejaculation does help, with the symptoms burden of the blue balls, and also improves blood flow to the area that helps clean out substances from the prostate that could be harmful, and overall improves prostate health. So it can be done via frequent sexual activity or masturbation.
Thank you guys. Thank you, Dr. Amoateng. Thank you, Dr. Pius. And at this time, we want to call on your closing remarks. For the sake of time, we're going to cut the questions short at this moment. So I will take the closing remarks from Dr. Afriyie first, and then Dr. Amoateng will follow through.
Thank you, Faraday. Yeah, I want to thank all of you for coming and participating in this event. It's a very wonderful session, and prostate is not something that we can ignore. It is part of our body, and as we have discussed in depth, we need to take measures. We need to do early screening, do health checkups, do a lot of physical activity, stress management, eat regular, healthy diet, so that, we don't end up with issues with our prostate, and that becomes a burden onto us and to our families. And whatever we've learned, we can also share with other friends and family, so that they can also take heed and, protect themselves and prevent prostate conditions. And I want to say thank you for giving me the audience, the ears, to listen to our presentation. Thank you.
Dr. G.
Okay, so thank you everybody for showing up today for this insightful presentation. As men, we need to take proactive steps on our health. We need to talk about our health. Sometimes they say problems shared is problem solved. So we should feel free. We shouldn't feel embarrassed to talk about our health. We should take actions. Early screening, very important, and prevention, like preventive steps, like the food. Food is medicine. Food is preventive medicine. So if you eat the right way, natural food, natural whole foods, high fiber food, greens, veggies, and another important thing is exercise. If we do all these things, we will not only prevent prostate cancer, but all sorts of diseases in general will be solved. So thank you for showing up today.
Appreciate you. I appreciate every one of you for coming to the program tonight, and I believe that we have actually gained some more insight. We've actually added some more tools into our toolbox, and as we continue to grow and as we continue to live, it is my prayer, my hope that we can all learn more about our healthy habits and things that are not so healthy, so that we can live as long as the Lord has destined for us to be here. At this time, I will call on our brother Isaac Amoateng to give us the closing prayer, and then I will hang out here a little bit. If anybody want to chit chat, you can stay back and chit chat till 7 o'clock or so. So, brother Isaac, please give us the closing prayer.
Place of God bless you to our doctors in our midst for such information. God bless you. May grace continue to abound from you. We are praying. But I want to thank you for tonight. You have been a blessing to us, and we are blessed. So we want to thank you for knowledge and wisdom. Life is sustained. In knowledge and wisdom, life is established. So we want to thank you and bless you for being a blessing to us, for teaching us, oh God. We have been taught in time and length. We are enlightened, and we pray that we will walk in this enlightenment. We pray, Lord, we will walk in this light, so that God, we will live and live well to your glory. May your name be glorified. If there is anybody who is going through any health situation, oh God, as we pray now, we pray that the hand of God is able to touch and make a new. The hand of God is able to touch and heal. May that healing hand touch you, oh God. We thank you, God bless you for tonight. And we know that you hold us and you keep us through this journey of life. In Jesus' name. Amen.
Amen. Amen.